Thank you so much for coming in. It's a very complex matter, the NHI, but it's something that needs to be spoken about at length because it affects every single South African, rich and poor. We've heard from the Democratic Alliance. They've drawn the line in the sand saying they're going to fight this no matter what. They've admitted that there is a need to address injustices and inequality within an important sector like health, but they don't believe that the NHI will do that. What is your initial response to that?
Thanks, Marcel, and thanks for the opportunity to respond. I think that what we need to understand is that this is not a new discussion. This discussion has come for 25 years, and we have reached a point where we've been through a green bill process, a green paper and a white paper. There have been previous drafts of the bill, and we now have a bill on the table. One thing is for certain, we cannot sustain the current health systems that we run in parallel in this country. We have a public sector and a private sector that don't share resources, and when they do share the resources, it's largely to the detriment of the public sector, and the taxpayer is the one who is suffering all the way. What is happening at the moment is that we have a health system on the public side that is spending somewhere around half of what is spent on healthcare. That's about 4.5%, 4.25% of GDP, on 85% of the public, and the other 15% of the public, the private sector, are spending their money, and the private sector are spending a very similar amount, slightly more money. The resources are taking a strain, and what is happening is that the public sector can't manage with the limited resources, and the private sector is so overserviced, the competition is so high that people are overservicing and doing all kinds of other activities which they sometimes try to justify, but really can't be justified in the face of all the need in the rest of the community. So what the NHI bill does is it puts a framework in place to try and establish a single health system for the whole of South Africa.
Now, that seemed to be at the heart of what the Democratic Alliance seems to have a problem with, the centralization of the NHI and taking away powers from the province. Is there any idea of exactly how that will take place?
Well, the bill lays out a number of things. The first one that I don't think anybody will disagree with, because that's pretty much how it works now, is the centralization of the money. There are people who are critical of the way in which the bill creates a public entity, and people refer to it as a state-owned enterprise, which it's not. It's a very different animal in law, and it is not the same as a state-owned enterprise. And that is where ultimately, once the bill is passed, the fund will be controlled. The machinery to deliver services is going to require every single partner. And there's a mechanism already where the provinces and the national department, the municipal or representatives of the municipal authorities, and even now with the private sector, where that we talk to one another and people exchange ideas. We don't always agree on policy. We don't always agree on how to implement something. But that we need a framework, and that people are consulted and have an opportunity to participate is a fact. How we implement a primary healthcare solution, for instance, the framework is in the bill. But from one part of the country, a rural area in the Eastern Cape, where you have one GP and 25 clinics around a district hospital, you will need to find different organizational arrangements along the same principle to nearby here in Randburg or Houghton in Johannesburg, where there are lots of general practitioners and fewer public facilities. But as long as we all understand that if we don't work together and we don't pool our collective resources, we are not going to see a healthy South Africa.
Now, speaking of those resources, there are some who would say that, yes, the private healthcare sector has been allowed to become an entire entity, or some would even say monster to its own, mainly because the government hasn't covered itself in glory in doing the best to its own ability to use the resources that it has. So how can we now trust that you're going to do a good job having all of those resources, as you've said, all in one pool?
Yeah, well, we can discuss the past and we can discuss the future. I would prefer to discuss the future and say in the past, and I've been in the health system for 35 years, in the past we had a very mixed up system as well, with lots of different authorities doing all kinds of things. We just find ourselves in the same situation now, and it doesn't help us to have a private sector that is not integrated into the total care and delivery system. There are lots of examples where people do work together between public and private sector at the moment, and we would like to see much more of that, but in a structured way that everybody is participating. So for me, the future is not in having parallel systems where the private sector continues with medical aids and the public sector continues to have a budget. For me, I think it is it's one of the logical solutions. It's why so many other countries have pooled their resources. We are one of at least 50 countries around the world who's grappling with reform at the moment, and most of them are going in one or other form, pooling their resources to get best impact for everyone. Of course, our problem in South Africa, which makes us so unique, is that the disparity between the haves and the have-nots is by far the highest of anywhere in the world. So the perceptions from people on one side of the spectrum to the other, the unemployed, poor person in a township or a rural area, compared with somebody who is managing very well, thank you, and has several motor cars and a nice house and so on, will be completely different. But it doesn't mean we can't share resources.
Now, money has been a major talking point, and the kind of money it will take to get NHI off the ground first, to implement it, and then to keep it running. Do we have a clearer picture? Because it wasn't very clear last week. I believe at that press conference that was held last week, they said, no, it won't be costing taxpayers any more money for the first couple of years of implementation. But then after that, there hasn't really been a price put on the table. And that's really alarmed people, that to implement something as large as it is said this will be, a business model of sorts is needed in terms of rands and cents.
Yeah, we've seen many models, right, from the very first models 20 years ago and the most recent models that have been done by both private people and government, even in Treasury. And to get an exact number is like chasing cats. There are so many variables and so many choices that can be made on the way that it is virtually impossible to pin a number down.
But the budget is important, you'll admit.
Yes, of course. So what we can say categorically is that we have about 220 billion rand in the public health system at the moment, and we have about 250 billion in the private sector at the moment. So that's 470 billion rand that you and I and our colleagues, the other 54 million or 55 million South Africans, are currently spending on healthcare. The problem is the way we spend it. We are wasting on one side and we are poor on the other side. So in the initial phases, what we will need is some investment in new systems. For instance, if we are going to start to integrate public and private providers and get them registered and accredited to be suppliers, there's an administrative process to do that. If you and I are going to be registered as individuals who are going to be beneficiaries of the NHI, we need to be registered and we need to be on an IT system. So we need the IT system. And there are many examples like that. So that is what we intend to do in this phase one. So we intend to have the office up and running in the National Department as part of the Minister's responsibilities by the 1st of January next year. That's our objective. A small nucleus office where we can bring all the learning, all the experiences to date, all the current people who work on bits and pieces that are related to the activities of the NHI into one space and start not to talk about pilots and what we can do or what we should do or think tanks or whatever, but start to convert what we already know into how we are going to do it. Operational and administrative systems to make sure that we are prepared for the NHI. Then there will be a period of about 5 years where you take the low-hanging fruit and start to implement these interventions and check how does a particular intervention work in a city with a metro compared with a deep rural area, compared with a township, and then systematically from the learning sites roll out until we've got the country covered. It will be a while before we start talking about, oh, we don't need medical aids and all that. I will get to a point where I will realize, as a citizen, I can get all this healthcare without paying a private medical aid. So that is where we would like to go, where the citizens make the choice.
And as a citizen yourself, you do, however, understand the hesitance to all these grand plans because you're making all the right noises, but it is taking place in a time where day by day we're still hearing about everything that went wrong in the administration of the SOEs that we already have. So you understand that backdrop to it and why people raise an eyebrow when you start talking about what you are planning to do.
Sure, of course. And I mean, nobody's going to say there was no corruption. We sit and we watch the Zondo Commission and other commissions on a daily basis. So we know about the problems, and none of us is blind to those. One of the very first offices in the new organization that we are going to create is the Fraud Prevention and Corruption Office, Anti-Corruption Office. because we need to anticipate, as we put systems in place, how people are going to try to abuse the system. You mustn't think that people don't abuse medical schemes at the moment. Everybody,
Absolutely.
clinicians, patients, suppliers, everybody. And we can all give anecdotes of those examples. So it's not about whether people will try to crook the system. And this is not a state-owned enterprise, which is an investment and making money and generating, supposed to be selling services. This is a public entity, like the Medical Research Council is a public entity that has a responsibility to deliver a service for us as citizens. And so I think it's a different animal, and the way in which we set it up is going to make a big difference. So I would say to the naysayers, join us. Come and sit together around the table. We also have concerns about how we're going to implement some of these things, and let's learn from one another. And as the Minister keeps reminding me, we will not get it right first time. Be humble, be prepared to make changes, and be prepared to take detours along the way. But we are going to get one health system.
Thank you so much, and thank you for taking us into your confidence to these private conversations. Thank you so much. Dr. Nicholas Crispin, he is a consultant in the Office of the National Minister, giving us their take on where they stand in terms of the implementation of NHI.